All right. Very cool coming in from Washington, D.C. So welcome, Ida. And I'll kick it off now. We have a few more people registered, so maybe they'll be coming in a few moments, but I don't want to hold up at all. My name is Callie. I'm the program coordinator here at the City Health Dashboard. I'm joined by Dana, the research analyst here. This session is going to be recorded, so if you want to watch it afterwards or send it out, I'll be sure to share with you. It's going to be a very informal session, so if you have any questions at all throughout, feel free to just throw them into the chat or take yourself off mute and just ask away. The kind of run of show for today, I'm going to be entering the dashboard a little bit. I'll talk about communicating data, using some data examples, talk a bit about visualizations, and then how you can use the dashboard to visualize data. And then we'll close out with just a Q&A. So if you have specific questions about certain metrics or your city or anything like that, happy to do like a little walkthrough at the end after the session. So I'll kick it off. So the dashboard is an online free resource that we have. And the goal was really to help mayors, city leaders, and anyone that cares about improving health within their community have access to the data that'll help them do that. So we started back in 2018, and we've grown since then from our 4 pilot cities all the way to 970 plus US cities. We have every city on the dashboard that has a population of more than 50,000. And every year we add more and more small to mid-sized cities. So we're growing that number all the time. We developed it here at NYU's School of Medicine and the Department of Population Health, and we work very closely with the NYU Wagner School, NRN, NLC, and ICMA, who are some of our bridging partners. And as we were creating the website and as we continue to update the website, we're always working with city leaders and partners and anyone that uses the site to make sure that it's easy to use, everyone understands what's happening on there, because at the end of the day, we have this data and we want people to know how to use it to improve their communities. So today's virtual office hours session is going to be really focused on data communication, and I'm going to be pulling a lot of the principles that I'm talking about from this one workbook that is available on the National Cancer Institute site. It's called Making Data Talk. They have a lot of great points, so I highly recommend everyone to check it out, but I'll kind of be going through what I think are kind of the main takeaways from this to help phrase the data communication chat. So first and foremost, whenever I'm communicating data to anyone, the most important question I think is considering who your audience is. You want to make sure that you are targeting your data communication to the correct way for that audience. So you want to make sure that they're believing what they're being recommended, making sure that they understand your rationale behind it, and then walking away with the so what. So why is this information important for them? And this sort of communication can vary if you're talking to a scientific audience versus just an everyday community member. So you really want to make sure that you're keen on who your audience actually is for this particular piece of data that you're trying to communicate. These are some tips that were included in the workbook on how to present audience-friendly data. One of the biggest takeaways that I use in my work every day here at the dashboard, and that I find is just really important, is trying to differentiate between words that we use in the scientific community and health community versus words that are everyday use. So for instance, the words cohort, longitudinal, that probably means a lot to someone who's been involved in works and studies and works in public health. But for individuals who might just be living in their community, these aren't words that they use in their everyday life. And so you want to make sure that you break those down. And maybe that's saying a study group and then explaining what sort of group that is, as opposed to using the scientific term for it. Other words that can get confusing are words with multiple meanings, such as surveillance, or words that are a little math and science heavy, such as proportions, relative risk. These might mean a lot to us, but they might not mean as much to a lay audience who needs these to be a bit more broken down. Oftentimes when people look at data, they'll just run with the first thing that they see and not think too much about it. So you want to make sure that that takeaway message is first and foremost and can't really get bogged down with the scientific stuff. So trying to make that as clear and lay friendly as possible. The The way we do this is kind of through two different methods of communication, and we like to call this the push-pull method of communication. So pushing is the more active form. So that's sending messages to audiences. It's saying doing a mass media campaign. Something that I think of is a great example of the push is, say, a targeted email campaign. So say you're interested in breast cancer and you want to push out more information on this, you could do an email campaign specifically about that, and that's pushing that data and information onto your audience. And then on the other end, there's the pull, and that's where you just have this information passively posted somewhere. So maybe it's a blog on a website, or a direct page, or a link where you're not actively pushing it out to the audience, but this is for the information seeking audience to be able to still get that information. And it's still a very important form of communication for data, but it's not something that you're actively always pushing out. So those are kind of the two methods that you want to think about, and it might require different approaches to communicating data between one versus the other. Some common mistakes that are very easy to make when communicating data is the things that people tend to misunderstand. And so it can often get a little confusing for people seeing 1 in 200, 1 in 25. What does that mean? So ways to kind of help explain that. Do you really need the numbers? Maybe you don't. Or using visualizations to help aid. And what does it actually mean to have a 1 in 25 risk versus a 1 in 200 risk, to really explain which one is more at risk for the person. That might be a little harder than just the number, or easier to understand than just seeing the numbers. Other things that are often confused are percentages versus percentage point change, or proportions versus percentages. These things, I mean, they're confusing even for me who works with data every day. So making sure you really make sure to break those down for your audience. Some best practices that we use when we are going to present data. Number one, and this was the first point that I made, was really understanding your audience and getting that bottom line across to them. So making sure that they know the takeaway and they don't have to do any work to find the takeaway. It's just up front and center for them. And then minimizing clutter. So you don't want something that is so overwhelming with data that it's hard to get that takeaway point. So really at the end of the day, when you're communicating data, even if there's a lot going on, sometimes it's best to break it up into different visualizations, different key points, as opposed to throwing it all into one, just to make it easier on your audience to really be able to understand what's happening there. So that was my little spiel about data. So now let's get into the fun stuff, which is visualizing the data and seeing how you can help people understand it. So a lot of people think that data can kind of speak for themselves. So here are two charts that I pulled up, and it's just the data. It's simply the year, local, state. It's got all the words on there. It's got all the data on there. But if you were scrolling through social media and this pops up, at least for me, it tells a story, but I don't know if it's one that I'd really stop on. I think there's like a little too much happening. There's a little too many numbers, and it would take me too much time to try to figure out what's going on. People, especially in our day and age, have a notoriously short attention span. So you want to make sure that when you're communicating data, it actually grabs their attention and grabs their interest. We're only able to really take in and process so much information at any given time because our memory is pretty limited. So you want to make sure that what you're communicating is actually able to be processed and taken in by your audience. We want to make sure it's clear and concise. So let's take these data in this graph, in this chart, and turn it into a graph that might be a little easier to understand. So I've taken the data that was in the graph and now or chart and put it into a graph form that's, I think, a little easier to understand. We've color coded it. So now it's local public health workers in red and state public health workers in green. And the take home message is pretty evident in that we have less public health workers now than we did during our last outbreak. So this is a pretty easy key message for workers to take across. It's the same exact data, but this would actually be a little easier to stop on and understand what's happening as opposed to just the chart with the numbers. Color and design helps a ton in data communication to help people really visualize. So this is going to be a chart that's way easier for an audience to understand and walk away from than the normal just chart was. So before I tackle any data visualization project, I really try to ask myself a few questions before I start the design work. The first is, what is the story? So what is the most important message that I'm trying to convey? And it needs to be pretty narrow. So for any data visualization project, you want to make sure that it's a very accessible story and it isn't too vague, because again, you're only trying to make one visualization for this data that's going to be understood by a wide audience, or you really want to know your audience. So maybe it's a little narrower, but you want to just know what that story is so you can hone in on it. It also needs to be a pretty compelling story. Is it worth communicating? So if the substance of the message is pretty dry, what can you do to spice it up? Is there other ways that you can communicate this data that might not need a data visualization, but you want to use a narrow and compelling story for your data? So really honing in on those first. And then, of course, knowing your audience and seeing what will resonate with them. So what sort of data are they interested in, and what sort of visualizations are going to be best for them? And then last but not least, how is this story relevant to humans? At the end of the day, we're all humans. We want to see stories of interest, but you want to make sure that's a story that we're actually interested in and might be a cause. So if there's any sort of human tie to it, what is that? And is that part of your take-home message? Other things that I think about too when I'm going through data visualization creation is, where am I putting this data visualization? Because I might be creating a different visual for, say, Instagram than I might be for a blog post. And so trying to think about, where is the end product ending up? Is it going to be a social media? Is it going to be on a website? Is it going to be in an email? And trying to use that to narrow down what sort of visualizations you might want to use. So here's a chart that might feel familiar, because it's a sort of bar chart that you might have seen at conferences, webinars. It's very common in the scientific community, but it's also a lot. There's a lot happening on a very simple bar chart that suddenly got 4 different colors, all these different methods and arrangements, and I don't even know where to start with it. So what's the main takeaway? It would take me a few minutes to figure it out. This is a visualization that would be compelling for a scientific audience, but it might not necessarily be one that is easy for an everyday lay audience to understand and walk away with the main message. So instead of translating the raw data into a visualization like we did before, let's try to redesign this one so that we can visualize this data and get that message across that we want to. So I've parted down to just the information that we want to see, and that's the natural disasters increasing over the years. We can see this trend line forming, and we've also reflected that in the title here. We've spelled it out very clearly for our audience. Natural disasters are increasing. It's hard to walk away from this not knowing that after those simple words in the title and seeing the trend line, but we can do even more. So by adding a color that is opposite and really finding that one takeaway message, it's the one thing we wanted our audience to walk away with. It's that 2010 set the highest number of dangerous natural disasters. So we colored that red so it's different, it stands out from everything else. And then we've also set the text and the title to really explain that to the audience. So there's 2 different points that you can get here that give you the same takeaway message. This will really stick out and be much more memorable for them than that original chart that was just overloaded with information. So now I'm going to go into a few other ways that you can visualize data that could be interesting. So here we have merging of multiple sources of data. So these maps were built using census tract data pulled from the American Community Survey, which is a data source that we trust and love here at the dashboard. We use a lot of their data on our site. And then this data from the American Community Survey was overlaid with data from the FCC, or the Federal Communications Commission, on broadband or internet connection speeds across the US. So we combined those 2 seemingly unrelated pieces of data, but then we're able to tell a story about how in many major cities, neighborhoods with high poverty rates are digitally redlined with poor broadband access and infrastructure. So this is a really interesting way to visualize that data and see that connection between 2 data sources. And it's pretty straightforward. It highlights exactly what we're trying to say, the least connected to broadband, deep poverty, and then it highlights the different areas in those maps throughout that are affected by this. Another example of data visualization is the Choropleth map. This one we love to use here as well. It's a really great way to explain data on a national scale. It's versatile, it's common. It's also very familiar to audiences nowadays after COVID-19 and any election season. It's a map that people understand and can really get at pretty quickly. So it's an this is a great option for geographic information or data that maybe varies across regions. Similar to the Choropleth map, we also have a tile map, but it removes the geographic size that might skew the data when population data is not relevant. So this really just breaks it down into what it is in a more even manner than the geographic one, which stretches with size. So a few resources that we like to use here at the dashboard for data visualization includes the DataVis project. They have tons and tons of data visualization examples, as well as codes and how to break it down. You're also able to work with them directly to really create any visualization that you can dream of. They're a great team and they've got a lot of great work. There's also flowingdata.com. So this is actually a blog and a data visualization guide. There are courses on here. It's resources. It's all run by Nathan Yao. And there's a ton of great inspiration on here on how to visualize data. I've really enjoyed those two sites for really just exploring different types of maps. And they have a lot of options that I don't think I could have thought of on my own. So they're really great resources to just start out your kind of data visualization journey. And then last but not least is DataWrapper. So this is a site that we use for almost every one of our data communications on the dashboard. You're able to just plug in any data here, choose the type of chart, and it just auto-populates. You're able to make it interactive. You can embed it on any website. So we use this often because we're able to do city level data here. For instance, on our City Health Dashboard About page, we have a map from DataWrapper that's of the whole US, and it highlights all the cities on the site, and you're able to hover over it and see what cities are where. So it's a really great way to kind of visualize data, but also you can make it a little more interactive, which is fun. So that was a lot of talking, but now let's dive a bit more into the dashboard and how we can actually apply the principles we've been talking about to data from the dashboard. So the dashboard, just kind of reiterating, but we were really created to help city leaders, advocates, and anyone who cares about improving health and well-being have access to data and be able to share that with their community to better health. So you can use the dashboard to compare health gaps across neighborhoods and dig deeper into what is causing those differences. You can use it to compare your city to cities in other regions or with similar population sizes or demographic factors, to help you really set goals and learn from what others are doing. And then you can also use the dashboard to help set priorities and better target resources to neighborhoods that need them most. So this here is an example in Columbus, Ohio of life expectancy. And you can see just within Columbus how the data, it really varies between neighborhoods within the city. So this is a really interesting way of visualizing it and seeing that data up front and center. So this is the dashboard. Instead of going to the site right now, I'm just going to walk through a few slides that kind of show how you can use some of our data to visualize or visualize some of our data, how to communicate it. And then if you want, I can do a more thorough walkthrough or go through any metrics or cities of interest for you afterwards. So we'll start out on the dashboard. If you were to go to the front page, you can type in any city here that you want. And then let's say we want to go to Richmond, Virginia. So this is what kind of populates when you go to Richmond, Virginia. You click on children in poverty. This is what you're going to see when you get to the site. So right up front and center, you see there's a map, there's a little bit of an explanation on the metric, and then there's this other visualization here. So that visualization is breaking down how does Richmond compare to the rest of the dashboard cities? And we make that very obvious. The key takeaway here is Richmond, Virginia's children in poverty is 30.2. If you want more of an explanation, we give that written out right above so that it's pretty easy to understand what does this number actually mean in context. Then right here, we also provide this breakdown of what do the symbols mean. So you're able to understand as you're walking through this visual, how does that apply? And then we have this scale bar of colors, and that scale bar directly links then to this map, where the darker colors are poorer outcomes, the lighter colors are better outcomes. And so you can see by neighborhoods how Richmond, Virginia is doing relative to children in poverty by various census tracts. So you can see here the range in Richmond goes from 0% to 100%. I've pulled out two different variations. You can see they're very close neighborhoods, and one is at 77.8% children in poverty versus this other one is at 2.9. And so that's a really compelling story of how very close neighborhoods have very different outcomes for poverty in this case. If we go to another tab on the City Health Dashboard, the next one, it's called Demographic Details. And so here you can see a breakdown of some demographics for this metric in the city. So in this case, we're looking at race ethnicity for children in poverty in Richmond, Virginia. So we can see here, this remains the same throughout the site. This triangle is representing the dashboard city average for whatever race ethnicity we're looking at. So in this case, this is the Asian dashboard city average of children in poverty for every city in the dashboard. Here, this is the Richmond average. So we can see that 28.2% of Asian residents in Richmond, Virginia children are experiencing poverty. And as we go through this, we see that there's variations between the racial ethnic breakdown, and we can see how those compare. If there's the green check mark, they're doing better than the dashboard city average for that racial ethnic group, versus if they don't, they're doing slightly worse. So this is a really interesting way to kind of see that data kind of broken down a little further, and again, using the similar visualizations throughout the site to help you kind of follow the journey and not have to use any new thinking skills as you go throughout. Another thing that I want to highlight from our site is the metric comparison feature. And so here we've put children in poverty in comparison to diabetes rates. And we can see here where the way that we do the map here, we have the scale bar. This is normal, and this is exactly what was happening before for just children in poverty. And then we've decided to add on another metric, and we've highlighted this here with the bubbles or the circles. And so then this circle scale bar then translates to the colored circles on the actual map. And so if you were to click into any one of these, it would show the numbers for both children in poverty and for the diabetes rates, but you can also visualize that here with just the colors, where the darker colors for both scale bars are the worst outcomes versus the lighter colors are the better outcomes. So that's just a few ways of how the dashboard can help you visualize data and help you communicate it to your audiences within your community. So that is the end of my spiel. If you want more information on the dashboard, make sure that you are subscribed to our mailing list so that you can find out whenever we're doing virtual office hours like this or when we update the site. We're also very active on social media, both on Twitter or X and LinkedIn, and we're always available for any questions, data questions, or otherwise at our email, info@cityhealthdashboard.com. But that was a lot of talking on my part, so I'm going to open the floor and see if you have any questions or you want me to do any walkthroughs for any cities or metrics of interest. Oops, I'll leave that slide up. And if you don't have any questions, feel free to hop off now. I'll stay on for the whole hour, so if you do, I'll be here. But otherwise, thank you so much for joining us. This was great.